Hello, welcome to all in Pharma Affairs Hub. Today we are going to remember the classification of antitubercular drugs via Mnemonics. This video is very helpful for all the pharmacy student or a medical student in aspect of their competitive examination and academic semester examination. So let's start video. Antitubercular drugs is classified into two parts. First is first line agent and second is second line agent. First line agent drugs are low potent and high resistance against gram-positive and gram-negative bacteria, whereas second-line agents are highly potent and low resistance against gram-positive and gram-negative bacteria. Now, for remembering the first-line drugs, we have a Mnemonics, Paris. Here, P stands for pyrazinamide, E ethambutol, R rifampin, I isoniazid, S streptomycin. Now, second line drugs are further subcategorized into three parts: fluoroquinolones, other oral drugs, and injectable drugs. For fluoroquinolones, we have a Mnemonics OMLC, and other oral drugs CERP, and for injectable drugs we have a Mnemonics cake. Fluoroquinolones, we have a Mnemonics OMLC. Here MLC represents the member of Legislative Council. So here O represent ofloxacin, M moxifloxacin, L levofloxacin, and C ciprofloxacin. Other oral drugs, we have a Mnemonics CERP. C and ERP means all of you are a university student, and for submission of your examination forms and a fees you should log into your ERP. So correlate the Mnemonics by your ERP portal for remembering of the other oral drugs. So C means cycloserine, E represent for ethionamide, here R represent for rifampicin and rifabutine, and P represents prothionamide and paramino salicylic acid. Now, injectable drugs, cake, CAK, here cake, capreomycin and amikacin and kanamycin. Thank you. If you like this Mnemonics, then please like the video for appreciation and subscribe the channel for more updates. Thank you.